Hi, my name is Jermaine Page and I'm a nursing student at Antonelli College. I want to talk to you today about the legal and ethical uses of restraints. First of all, I want to define restraint, which is to prevent someone or something from doing something, to control or to limit. You have three main types of restraints. You have your physical, your chemical, and your environmental restraints. With your physical restraints, they normally use leather straps that go over your arms, your waist, or your legs. They are used to restrict movement. With your chemical restraints, chemical restraints are normally three drugs mixed together, which are Benadryl, Hydol, and Ativan. The mixture of these three drugs is known as a B52. Then you have your environmental restraints, which is simply moving a client to a secluded or a space or another room and putting them behind a locked door. Okay, you also have your ECRs, which is your emergency chemical restraints, which is basically like I talked about earlier, the mixture of the three drugs, the Benadryl, the Hydol, and the Ativan, which can be given orally or can be given in the IM injection. And this IM injection can be forced. And you also have your EPR, which is your emergency physical restraint, which is simply you can put restraints on the client's wrists, arms, or their waist, or their legs. Before restraints can be applied, a physician must authorize the use of the restraints. They must have a limited time of use. With physical restraints, they must be frequently checked to make sure that they don't get too tight or hurt the client, cause harm to the client. But before you apply restraints, you want to make sure that you use the least restrictive measures first. Make sure you have exhausted all of those before you resort to using restraints. Some of the common problems with physical restraints are loss of muscle tone, pressure sores, incontinence, loss of mobility, and cardiovascular stress. And some of your common problems with chemical restraints are loss of cognition, hallucinations, and loss of ADLs. And with your environmental restraints, you have reduced social contact, decreased desire to eat, and withdrawal from your surroundings. Now, some of your common ethical considerations for using the use of restraints are: number one, is it important to the patient? Number two, is the safety of the patient or the staff or other clients at risk? what is best for the patient, what does the patient want, and you also must ask yourself, are there other alternatives? You remember, you always want to use the least restrictive method. And you must remember that residents have the right to be free of physical and chemical restraints. Go ahead. And remember that the client has autonomy, which they have the right to make the decision on what happens to them.
We're back home at the moment. Well, leave your name and number. We'll get back as soon as possible.
Okay, some of your legal considerations of using restraints. The healthcare staff is able to act in the best interest of the individual who would otherwise experience pain and suffering due to the common law principle of necessity. Failure to take care of the client could lead to negligence by the medical staff. Restraints may only be used when they are clinically justified, and a written procedure must always be posted when using restraints. They must be followed. Whenever restraints are to be applied or to be removed, you must have trained personnel. They must apply and remove the restraints. Okay. When using physical restraints, make sure the device is not too tight. You want to make sure that the limb is in a comfortable position. Normally when they apply restraints, they put a sleeve or a bandage on there to protect the skin.
Yeah.
Do not apply a restraint over a client's chest, because you could restrict their breathing. Always restrain both sides. Never restrain just one side of a client's arm or leg or medications may be forced. IM injection of the B52 may be forced in an emergency. You want to make sure that you offer the client frequent trips to the bathroom every 1 to 2 hours. You also want to make sure that you offer frequent meals to the client. You want to make sure that you give them fluids. You want to frequently offer them fluids. You want to make sure also that, you know, if you serve them, you want to make sure that it's in a styrofoam plate or container to keep them from injuring themselves or other staff members. You want to frequently assess the site, check the skin, pulse, to make sure that there's no injuries or anything from having on the restraints. After any client has been restrained, they must be interviewed to check and make sure that they're okay and that nothing has gone on in the time that they've been under restraints. Any client under restraints must have one-on-one supervision. Always. And you always want to make sure that you document. You won't make sure, because if you do not document, you didn't do it. Now, at this time, I want to show you a picture of a physical restraint. So we can see here on this picture, right here is your leg restraints. Right here you have your arm restraints. Right here we have your waist restraints. We want to make sure that we check the client frequently and that we document.
Yeah.
At this time, this ends my presentation on the legal and ethical uses of restraints. Thank you.